Hey everybody, my name is Luan Stout. I think I've met almost everyone in some way or another in the cafeteria or in the hallway or over cookies. So I'm Luan. I am the Director of Academic Support. So this university, like all universities, we make sure students with disabilities have accommodations. And I just want to let you know what our office does and how we can help you and how we can be partners. I tell Carolyn Dirksen as my immediate supervisor, and I tell her all the time that I'm split right in half, 50% student, 50% faculty. I try to make sure I'm the mediator and right between both sides and not lean more one side or the other, but sometimes inevitably that happens. I'm going to give you a copy of our accommodation form, which you've probably already seen. And some of you came to a workshop that I hosted, I guess that's the right way to put it, beginning of the semester when we had our faculty orientation. Some of you got to go to that. This is probably the most important thing you'll see from our office, is this accommodation form. If students have met with me, they have a disability, they've given me documentation, they've given proof. The Americans with Disability Amended Act in 2011 stated that it cannot be burdensome for people with disabilities to prove a disability. So we're taking things like IEPs, which is something that happens K through 12 if a student has a disability. The more current, the better, but we do abide by that new law. On here we have what their accommodations might be. The one that is used most frequently, is the alternative test site and the extended test time. That is the one that is used by probably 95% of our students. The person's in a wheelchair, and they have upper body abilities, but just not the lower, then obviously they're not going to have extended time. They just need to make sure they can get into the dorms and into your classrooms. But other than that, extended test time is usually the one that we use the most. That is double time. That's really, besides you knowing that, has nothing to do with you. We accommodate them for that. They come to our office and we have a testing room. We have a quiet testing room. It's especially important for students with attention deficit, that people aren't getting up before them and rattling papers, that maybe you walk in and out of the room or TA's there instead of you. Those kind of things are distracting. So that's why they come to us. If a student gives you this form and they're going to take the test with us, your responsibility is to send the test to us. That's what your responsibility is. The rule of thumb is that they take the test the same time that you're giving the test. So if you give the test at 10 a.m., they take it with us at 10 a.m. But because they get double time, that means they're with us from 10 through 11 until noon. But if they have back-to-back classes, we can't skip the math class just because they're taking a history test at double time. So we have to find another time for them to take their test with us. But usually they're taking it at the same time that you're giving it to your students. They come directly to us. They don't go to you. They come directly to us. We are very secure. They can take nothing in the test room except for a pencil, test, and their brain. That's all they're allowed to take with them. No phones, no calculators unless you say they can or it's part of their accommodation. And very, very secure in that. We're moving to the humanities building. Did you know that? We're moving soon. They're building now. If you're in that building, take a look. I'm in 105. We've had some elevator issues in the administrative building, major issues, and that's not good for people with physical limitations. So we are moving to humanities first floor. In that new building, our testing space has gone from 6 people to 12 people space. That's awesome. So we'll have more roomier space for our students taking a test. In that, this is my point of telling you, we're getting cameras. So there will be cameras to really make sure there's no cheating going on, even further than us having a watchful eye. The walls are glass, plexiglass. We can always monitor visually, but I think the extra video cameras are going to be even more helpful. That happens the most. Tutoring happens for any student who would like to have a free tutor. That's an accommodation we offer. Note taking, that's something you have to be involved in. If the student wants to receive this, if they have this as their accommodation and they want to take advantage of it, then you have to help them out a little bit. One of two things can happen. You can find somebody for them. If if you've had such and such student before, you know they're a good note taker, you can just pair them up and say, he's going to get a copy of notes from you. They come to our office, we make copies. Always better to type it, they can just zip an email and send it to them, and the student with disability can enlarge the font if needed, that kind of thing. If you don't know anybody in the classroom yet, everybody's new to you as well, then you make an announcement. And this is how you say it. There is a student who needs a copy of somebody's notes. If you're willing to share your notes, please come see me. Notice how I did not use a student name. That's embarrassing for them. So please don't say, Johnny boy needs a note taker. Would you help him out, poor soul? So if you present it in that manner. When the student comes up to you, you say, sure, I'll share my notes, no problem. You introduce the two, and that's all you do. You've done your job. So one of those two things will happen. If a person has a note taking on their accommodation form, and they don't ask you to help, that means they have a buddy in the room, they can get their own notes from somebody, or they're going to be progressive themselves and find their own note taker. So that's why it's important to have a discussion with them about the note taking part. The other one, scribe for test and reader for test, that's nothing to do with you. Again, they're taking the test with us. We take care of that. If a person needs a reader, they have a severe learning disability or severe cognitive delay processing, so we read to them. If they have a scribe, again, there's a mental malfunction going on, so to speak, that they can't get it down. So they say it to us and we write it verbatim. That's how we do the scribe. Not very often that happens, but probably out of 120 students, we have about 10 go into that category. The other accommodation, reader for supplemental materials. As you know, sometimes you don't always give assignments from the book. You might give an assignment from a really great article or a chapter in the library. If they have a hard time reading, we'll hire a reader for them to read that chapter or that article for them. This is just an FYI for you to kind of hope that you take the hint. Don't ask them to read out loud in class. Interpreters, currently we don't have any students who need a sign language interpreter. If you know me, I have a heart and passion for deafness, deaf education, deaf people. So I'm always trying to recruit and pull in people who use sign language. Currently are people who have a hearing loss or oral, and they use hearing aids and they're just fine. But eventually, my hope is that Lee is one of those Christian schools that really pulls in people who need sign language. Easily accessible classrooms and dorms, we take care of that, physical impairments. And then tape text, which is an old way, but we still say it in my field, books on CD, audio books. And that is our responsibility to help them out with that. Testing accommodations, sometimes a student might just really need to use a computer to take the test because of the processing delay or because of just different issues that we discuss, and I feel like that's the right place for them to take their test by computer. Occasionally, you might need to be willing to give the test orally. The person is intelligent, they're bright, they have to be to come to college, and they have a standard diploma. But the thing is, some students just need you to discuss the test with them. Again, that doesn't happen a whole lot, but when it does, we ask you to accommodate and work with them. So what you will be doing, anything that concerns you, is to send the test to us, if they're going to take the test with us, to help them with note taker if that's what they want you to do, and possibly give an oral test from time to time. We send this to you so you can kind of get an idea of the student and what's going on here. If every check is marked, don't freak out. They can do it. These are the accommodations to make it fair and even and equal. And with these, they should be able to do the same things that your students do without accommodations. If they can't do it with these accommodations, then several things. Maybe they didn't stay up for your class like other students sometimes don't. Maybe they are not going to be able to make it in college. That's for them to figure out. So do these things, treat them like you treat everybody else, and let's see if they can do it. Any questions? Have you seen something here you're not quite sure how to do, what to do? Yes, sir.
I had a student bring me one that said they needed taped notes.
Okay.
Is that the same as the textbook? Or?
No. That would mean they're going to record your lecture. So
I don't
that,
have to record it for them though.
No.
Okay.
Mm-mm. That's just to let you know that I will be recording my lecture. And then what a lot of them will do is go back and listen and retype their notes.
Okay.
It's me. Okay. We will only receive this if a student tells your office that it's okay to send this, right?
Right, this comes directly from my office.
Okay. If we have a student that we suspect, that we wonder if maybe they have some accommodations, I've had one who I never got this on, can we ask you?
That's
or
a great question.
how do you do that?
Okay, let's talk about that. If they don't self-identify to me first, you have no obligation. If they self-identify, say, Dr. Shaw, I got a disability, here's my disability, my information about it, and we have a form. It's up to them who they give it to. I have students who only give this to their foreign language teachers because they feel like they're fine for math and history, etc. But foreign language, they struggle, and they get for 4 semesters use this for foreign language. I have some students who only use this for finals week because no matter how much ADHD medicine they take, finals week they're still crazy nervous, so they only come to us for finals week. So it's up to the student how much they want to use the accommodation. What if somebody doesn't show it to you and you're wondering? Well, if you're close enough with them, you could bring them in like you would any student. Hey, listen, you didn't do so great on the test. What's going on? And you can have that kind of chat as long as you're gentle and not blunt. Like, I think you got a learning disability. You never would want something like that to be addressed in a meeting. Yes, sir. Is that your question too, Nikki?
Yes.
Okay. Yes, sir.
I have a student who I had last semester, and she had an accommodation form, and now she got a D in the course, so she's retaking the same course with me this semester. So does she need to give me another form?
Yes, she does. Every semester, up here it has a semester in the year, and then we sign it again. Since you know her, it would be really good if you said, hey, are you going to use your accommodations again? We want to make sure that you have a better grade this time. I think it would be appropriate to do that.
Afternoon. Rainy afternoon for sure. I'm Mickey Moore, the director of the health clinic on the Lee campus. And I'm going to tell you a little bit about the services that we offer for the students at Lee. All full-time students who come are eligible and are charged for health services. They pay a fee each semester to use the health clinic. Right now it's $75, and for that $75 they have unlimited visits to the health clinic to see the nurse and or the physician. They can come every day of the semester if they want to or if they need to, and they'll be seen and taken care of. We buy medications, prescription medicines each semester that we give to the students. Antibiotics, pain medicines, not narcotic type pain medicines, but some other kinds. There are just a few things that we have to charge them for, $5, maybe $10 for medications that cost us a significant amount, over $10. We do minor lab testing for students. We can do blood draws that we send out to outsourced labs if they have need of that. Students who have needs that they have to monitor certain functions, we can draw blood if their physician sends us a prescription with an order to do that. And we have students that we do that at least once a month for to check their levels of like thyroid or something like that. We have a number of students who require allergy injections. We give those to the students. There's no charge for that. And just in general, the local allergist office is $15 to $25 per time they go to get it if they were to do that. So that's a great benefit for the students. One of the major things that we do is prepare the students for the Global Perspectives trips. We spend a good bit of time researching and finding out information about what is required and recommended for trips that the students are going on. Each year we're sending about 600 to 650 students around the world to do their global perspectives trips. And each area of the world, of course, has recommendations of immunizations and other information that they will need, that we prepare and do an individualized report for each student that's traveling. We do most all immunizations that are used by our students at Lee, we keep in the office, and we administer those to the students. That is one of the items that the student is responsible to pay for. But we only charge for those things just about what we get, what we pay for it to get it. So it used to be that the health department would charge less than they do, but now they've increased their charges, plus they charge a $10 fee each time that they go to get an immunization at the health department. So we're saving them money as much as we can, and with that many students traveling, it makes a difference, I'm sure. Students are all required to have a physical exam before they can go on a trip. There are some stipulations about that as well as to the time frame. If they've had one in a certain amount of time, we accept that they have had that, and if it's valid, we'll allow them to use that. Our charge for a physical is $35, which is reasonable if you've had a physical done at your doctor's office anytime recently. One of the big things is we don't accept insurance. We're not set up to do insurance filing or coverage. What we can do, though, for those students who require frequent blood draws, we can submit to the laboratory a copy of their insurance information, and they will file that with their insurance. So that helps them out as well. We do wellness programs. We do counseling for diabetes. We do counseling to individual students for dietary needs. We have a physician on staff in the clinic all the hours that we're open. Our basic hours are 8 o'clock in the morning until 5 in the afternoon. And we do have MD physicians who staff our clinic those 5 days. Our nursing staff is RNs. We normally have 3 at a time who are working, and on the busier times, which we see as Tuesday and Thursday afternoon, we have an extra person there. We also have 3 office staff members who maintain our records and answer the phones and such as that. Students do not have to make an appointment to come to the clinic. They walk in and see the nurse first, and they're evaluated, and if it's necessary for them to see a physician, we make an appointment with the physician. It may be right then if the space is available, or they may be asked to come back later that day, or if it's something that's not really urgent, it may be the next day when they come back. Our physician staff, Dr. Jolie Devane is our regular Monday through Thursday physician. Dr. Devane had her experience working in office as a pediatrician. She is also certified in internal medicine. Dr. Dwayne Knight, who is also on the teaching staff at Lee, he's over their athletic training program. He works some hours with us also. Mostly takes care of the sports injuries and the student athletes. And Dr. Don Robinson, who has a private practice in Cleveland, is our medical director, and he works with us every other Friday in the clinic. So we have some excellent physician staff to take care of our students. One of the things that we would like to improve on or expand is our ability to see staff and faculty. Currently, we're seeing 50 to 60 student visits a day, and that's a little bit low from what we normally do. Fortunately, we haven't had flu, and we haven't had any really serious epidemics of sickness on campus last semester or this semester. But we currently aren't set up to see staff and faculty in that vein. If you're leading a Global Perspectives trip, though, you're welcome to come and get your immunizations from us if you choose to do that. We prefer that the staff and faculty folks have a private physician in town, especially if they have an ongoing medical condition that needs frequent attention. It's just difficult for us to manage any more than we're doing now. We've been discussing through our wellness program to try to offer some after-hours service for the staff and faculty, but at the current time, that's not been put into play. But hopefully we'll be able to get that done before too long, because I think that would be a great advantage for the folks who need medical attention, that they don't need to go to their doctor's office or they don't want to go to the ER and such, but it would be done at a minimum cash charge. But as I say, through our wellness committee, we're looking into that to see if we can get that done. Generally, that's how we function. Students certainly take advantage. In my estimation, probably only 30% of the students who are on campus at any semester come and see us. But the same ones keep coming back, so they must like us, I guess. As the one said, we'll have time for questions afterwards, and if you think of something that we can answer for you, feel free to ask. Thank you.
I'm Chrissy Logue. I'm the director of the Counseling Center, and I'm a licensed psychologist. So I'm kind of like LaJuan. I've got my foot in two camps. Just kind of sort of faculty, and then kind of sort of administrator slash service deliverer. So what I think the overarching surprise for most people is that the Counseling Center is a mental health service provider. Really rare for people to come in and want to chat about being homesick or their boyfriend broke up with them. I mean, every now and then, that's a nice break from eating disorders and suicidality and serious drug abuse, addiction, substance abuse issues and depression and OCD and panic attacks and all that sort of stuff. But primarily we are a mental health service provider. And like Mickey was saying, if you compare the cost of free to what you would pay for a session of therapy in the real world, it's phenomenal, the service that our students are getting. It's pretty amazing. They're really lucky to have free mental health services here on campus. So we're staffed by a licensed psychologist. There are 3 of us that are licensed psychologists. We have a couple of licensed mental health, licensed professional counselors who are certified as mental health service providers. And then the rest of our staff is made up of counseling interns from the graduate program in mental health counseling. Soon we will be transitioning. As you know, the mental health counseling program is going away, being replaced by the marriage and family therapy program in the Department of Behavioral and Social Sciences, and so soon we will also be partnering with those graduate students to some degree. I'm not exactly sure what that's going to look like. So I say that to let you know that our staff is really diverse. There are several of us. In fact, we have 5 senior staff and 5 interns right now, so that's 10 different providers that your student may end up seeing if they come to our office. And we try to make those assignments on a really strategic basis. So if you can help us as you refer to not say, I think it's a great idea if you were to seek counseling and there's this great person over there, you need to go over there, ask to see Dr. Lowe. Please help us with that. Don't refer to a particular person, just get them to us, and then we'll assess them and figure out who or what would be the best resource for them. Because we not only have individual therapy, but we're really excited. Over the past year, we have really launched an amazing group therapy program. And I'm going to give you a handout in case I'm talking a little too fast. All this is going to be on your handout, and on the back of the handout is a flyer that talks about our group therapy service. And the exciting thing about group therapy is it is not the consolation prize. So please help us with that. If your student comes to us and they come back to you and say, they tried to get me in this group. Oh, I'm so sorry. It's not the consolation prize. In fact, the research suggests that group therapy is the treatment of choice for particular things. And we'll assess that at intake and figure out, especially things that can be addressed through universality, like sexual assault, family of origin issues, social issues, boundaries, trust, communication. There's so many things that can be better addressed in the context of peers and that supportive environment. So we're really excited about that. You'll see on the back of your handout a list. We have at least 6, if not more, therapy groups that are going to be up and running, and students can take advantage of that. We also have a psychiatrist that comes once a month and a nurse practitioner that comes once a week. Again, if you've ever priced psychiatric services on the outside, you know that these folks are expensive, and so it is a massive benefit to our students who need medication to get that through us. Here's the caveat though. Because the psychiatrist's time and the nurse practitioner's time is very expensive and we have to buy it, we have to be very limited in who we allow to access that. So the number one rule is you can't just do meds through us. If you just want meds, we'll be happy to provide you to referrals to outside community. And there are plenty of providers in the community who they can get meds from. The only people who access our med providers are people who are currently engaged in therapy, because we are a counseling center, not a medication center. So there's a good chance that through the course of therapy, it will be indicated that they seek antidepressants or anti-anxiety or ADHD meds or whatever, and we'll take care of that referral in-house, and sometimes even the meds are free. So that's not a guarantee, but sometimes our providers will even have samples. So a student could walk out with a free appointment with a psychologist, a free consultation with a psychiatrist, and a sample pack that's going to do it for 30 days, which is amazing. All of our services, of course, are free and confidential. That's important too, and it's important for our students to recognize, and it's also important for you guys to recognize as well, because what happens is people will refer to us and they have the best of intentions. They're not trying to pry or meddle, but they're just concerned, and they call up and say, hey, I'm so concerned about Johnny. Did he make it over to the counseling center? And legally we have to say, I'm sorry, I can neither confirm nor deny whether I have any awareness of Johnny. And that's to protect his confidentiality. That's not to, shove you out the door, to put a hand in your face. That's solely to protect his confidentiality, and we're legally mandated to do that. So if you feel like you've got a close enough relationship with Johnny that you would want to consult with his therapist, and you think he would want us to consult with you, he can sign a release. That is not a problem. We're happy to talk with whoever the student wants us to talk to. We just can't do that without their permission. And I've had people say, oh, no, I don't want to know anything about their therapy. I just want to know if they're coming. Well, that's still about their therapy. We still can't disclose that as well. So just help us in understanding that. We've got a couple of new treatment things that are going on this semester that we're really excited about. This is stuff that we really, really need, and so it's just awesome that we're able to roll this out. One is a substance abuse treatment group. That is, you're going to see that on our list of group offerings. It's probably no surprise to anybody in this room that substance issues are an issue everywhere in the world, and Lee is not an exception. And so we're starting a group particularly focused on the people who want to work on their substance abuse issues. And believe me, FYI, we're not talking about the person who tried a beer for the first time. We're talking about substance issues, people who meet DSM criteria for substance dependence, and alcohol, marijuana, you name it. It's all going on. The other thing we're really excited about is something we're calling ECAT. It stands for Eating Concerns Awareness and Treatment Team. The American Psychological Association, American Psychiatric Association, both have indicated that the treatment of choice for eating disorders is a team approach. Medical professionals, nutritional consultants, psychosocial living, people in the living environment like Res Life, those sort of folks in conjunction with therapists. Basically the idea is if you're treating an eating disorder as a one-man show or a one-woman show, that's really doing your client a disservice. And so we've pulled together this team. Mickey's going to be on the team. We'll have people from Res Life. We have some people doing some nutritional consultation, and students who present to us with eating concerns or eating disorders will keep their individual therapist at the counseling center, but that person will work in conjunction with this team who will do weigh-ins, blood work, referral for additional services as necessary. It's just going to be a nice adjunct to what we're already doing. Addressing something like anorexia or bulimia in a 45-minute outpatient generalist sort of therapy conversation, that's like a drop in the bucket, basically. I mean, most folks need much more intervention, and that's what we're trying to provide up to a certain level, and then of course we'll refer on to residential or partial hospitalization as needed, and that happens from time to time. Okay, that's our clinical services, and it's just kind of a snapshot. The bottom line there is there's really no problem too big or too small. So don't hesitate to send folks to us. Don't be like, oh, well, they're not suicidal, so I better not send them over there. Send them on. I mean, we'll do the best we can to place them in the services that we have available. But if you do see something really big, that's what we're here for. We're not just, a rent-a-friend kind of thing, but we're licensed mental health practitioners. Another thing that you might be interested in that we can do for you is outreach programming. We are really knowledgeable on issues like eating disorders and depression and anxiety, suicide, multicultural issues, relationships, bipolar, you name it, that kind of stuff. If you want somebody to come to your class or to your club meeting, we'd be happy to do that. That's fun. We get to get out and do some different stuff. And we have these graduate interns who need those experiences. And so, you might get one of us, you might get one of the interns, but somebody will come to your group and talk about whatever it is that you want us to talk about. We do that all the time. We're happy to do that. We've done programming for clubs. For example, the Psych Club had me come in and do QPR training. QPR is like the mental health version of CPR. So, it's about a 2-hour course, and you get a little card, and you're QPR certified, and you put it on your resume. And, it's just it's a nice awareness raising about suicide and suicide prevention, and basically lay people's training of how to talk to somebody about suicide and what to do if somebody talks about being suicidal. So, if you want us to come do something like that, then that's just an example of something we could do. Another outreach thing that we've offered is team building. You could take the Myers-Briggs, and, we all know that's about as psychometrically sound as like a Cosmo magazine, but it's still fun, it's fun to kind of learn about yourself and learn about your peers and talk about it. It can spark some good discussion, so that's a fun outreach that we've done for teams or offices or departments. We've come in and led some kind of team building activity like that. Okay, so there's the clinical piece, there's the outreach piece, and then there's the consultation piece, and this is where you can become our client in a way, not in a personal therapy sense, but if you need consultation on how do I refer to you guys, how do I get services for myself? We can't provide you with mental health services. I can't be your therapist because I'm also your colleague, and you don't want that. That just makes sense. But I've had plenty of people come in and talk to me and say, hey, I know you can't be my therapist, but let me just give you a rundown on what's going on, and you can then recommend somebody in the community who you think would be a good fit. Happy to have that conversation. Totally fine. It'll be confidential. You can tell me as much or as little as you want, and I won't take on the role of your therapist, but I'll say, based on what you're telling me, I think this person will be a good fit, or here's some people in Chattanooga I really like, that sort of thing. That happens pretty frequently, and we're happy to do that. You might be working with students who maybe don't want to come to the counseling center, or you feel like maybe they're not at the level of needing to refer them, but you just want some tips on how to talk with your students about grief or stress or more of those normal life issues. So you want to be careful to not put yourself in the role of providing mental health services. For example, I've had students come in and say, yeah, I finally came to the counseling center because I kept talking to Dr. So-and-so about my depression, and he was really helping with my depression. I was like, ooh, that puts Dr. So-and-so in such a scary position, because even if he never said, the student assumed that person was providing him treatment for his depression, which is actually illegal because you're providing a service for which you're not licensed. The state protects the services that people who have the license can do, and you might say, oh, no, it's just mentoring, we were just talking. But that student thought he was talking to you about his depression. That's treatment and diagnosis of a mental illness, which is reserved solely for people who are licensed, and it could just get you in really big trouble. So be really careful about that. It's not like we're like, oh, we're the only people who know how to do this. I understand I've had people say to me before, like, yeah, I would talk to my student about this stuff, but, because, anybody can have this conversation, but I'm really too busy, so I'm going to send them to you. And I'm like, okay, that's fine. I didn't go to grad school for 100 years, but whatever, that's fine. It's not like we're trying to have the market cornered on we're the only people who can be supportive. I'm really trying to protect you, because we carry liability insurance. We're licensed by the state for a reason, so that if something were to happen or whatever, we've got that liability coverage, and you don't, and they could sue you, and it could be a big problem. So refer to us, but when it's not at that point, and you are just having those conversations, and you want some tips on, how to encourage my student to deal with these family issues when they go home, or how to talk with them about grief, we're happy to consult with you about that. What about, this is the question I usually get, is like, okay, what about in a crisis? What do I do? I've got a student who wrote a paper, and in the paper they said they're thinking about suicide. Or, a student came to me and said they haven't eaten in 5 days. What do I do? Or a student has just professed their serious substance abuse issue to me. Number one, don't forget that when a situation goes from the, I think they need counseling, to the, this is really like crisis oriented, be sure that Mike Hayes knows. Please, 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 make him your first phone call. Make sure he knows about anything that you feel like is crisis or danger oriented. Let him know, because he heads up what's called the Student Concerns Committee. That is a cross-disciplinary student development group of people who try to keep students who are in danger on our radar, and we try to intervene as best we can. If you leave that information with me, it will get stuck with me because of confidentiality. If you leave it with Mike, he can then rally the troops whether that be me or Mickey or Luan or Res Life, he can rally all the troops to help that student. So it's much better that he know about any like danger or crisis or safety situation. And then, you know, we can always fall into place under that. If you're not sure and you want help figuring out that decision, happy to help you. Give me a call anytime. The other option you have, and this number will be on the sheet that I give you, there's a local crisis response team. Free community service 24/7. If you were ever stuck, you know, you're on Facebook at 3 o'clock in the morning and, you know, you pull it up and the student is like, goodbye, Dr. So-and-so, you know, it's been nice knowing you. You're like, ah! You know, okay, 911, that's always an option if you can find a way to, if you know where they're at. Another option if you don't want the ambulances roaring and the police, you know, the siren and whatever. Crisis response, free 24/7. The number's on your sheet. You can call them anytime and at least just consult with them. And if you say, hey, I know my student lives at 123 Elm Street, they'll go to their location. They will send somebody there, not a siren, not an ambulance, but they'll send somebody there to assess. So it's just another resource for you, another option. And of course, you know, you can always ask us to help you figure that out. So there's the safety and the crisis level. Then there's the, okay, well, I'm not even really ready to refer level. You know, this is a conversation I'm comfortable having. And then there's the in-between, like, okay, they really do need to get to counseling. My biggest tip for that process is just normalize it. Don't freak out about it. Don't be like, okay, I think you might want to go to the counseling center, right? Like, if you can just make it super normal, like, hey, you know, you told me about a lot of these problems, and there's these folks at the counseling center that's free, and you want to go? Hey, I'll walk over there with you. I mean, the more sort of laid back and just normalizing, depathologizing you can make the experience, the better we'll all be. So, how to get started? All they have to do is show up. They just walk in during one of our intake times, which is on our website or on these cards that you're welcome to take a few cards back to your office just so that you've got them. The intake times are listed here. There is an intake slot every day of the week except for Wednesday. So the longest anybody would have to wait from the moment they decide, I think I want counseling, to when they could, if they're willing to, you know, rearrange their schedule or whatever, would be like 72 hours. If you decided on Friday afternoon, you'd have to wait till Monday afternoon. That is an amazing wait period, because if you call any therapist in the community, they'll be like, yeah, we'll see you in 3 months, right? Or, you know, worse, 2-3 months. So the fact that a student can come in within 2 days is phenomenal. So what you might hear from them is, yeah, I wanted to go in and they said I gotta wait till tomorrow. Like, okay, yeah, that's fantastic. Go in tomorrow, get that done. Mm-hmm. Or they said, yeah, I gotta show up to one of these walk-in times, and I've got class during all these walk-in times. They miss class for a lot of different reasons, and if they tell us that, we'll make it quick. I mean, we can have them in and they're out in 10-15 minutes for that just initial assessment. The other thing that faculty have misunderstood is they feel like the intake is a hoop. Like, yeah, I just want to get my student in for counseling. They tell me they got to show up and they got to fill out this paperwork and they got to do this intake. It's not a hoop. In fact, it's a facilitated maneuver, because if we did everything by appointment, the research shows that they would be waiting 2 to 3 weeks for that first appointment. Whereas if we do this walk-in triage system, we can get face-to-face with somebody really, really quickly, figure out how severe they are, what they need, and then plug them into the best service, whether it be individual counseling, whether it be group therapy, the different types of counselors, whatever. So the walk-in intake process, please help us get the word out, and how you communicate it to them will be how they hear it, right? So if you communicate as like, oh, there's these hoops, and you gotta go do all this stuff, like, no, it's super simple, easy paperwork, just print it off the website, fill it out, show up, and you can get face-to-face with a counselor within 2 days. So your spin on it is really important to us. Bad news, a little bit of bad news, but this is the reality, is that we have a wait list. So this wait list is more than likely gonna be our reality from here till eternity, until, you know, massive things change. So if you send somebody to us and they come back to you and say, yeah, they put me on this wait list, what's up with that? Say, that's normal, that's just the way things are. If you're not happy with the wait list, please complain to the people in the positions above us, Mike Hayes, VP, Dr. Kahn. That is not bad for us. We are happy for students to go to that level and say, I'm on a wait list and I don't like it. We are thrilled when so please encourage them. If they're not happy with being placed on a wait list, go to the higher ups, because there's nothing we can do about it. We only have so many hours in the day. But you be prepared to know that that may be what they say. We cycle through our wait list as quickly as we can. We make decisions based on when they came in and severity level. So somebody might get trumped if they are actively suicidal. Okay, well, if they're actively suicidal, That's a different situation. But, active manifestations of depression, eating disorder, those kind of things, we have a severity scale rating, and we use that to strategically place people a little more quickly based on severity. So, if you have any questions after this meeting, my email is on the sheet. And again, the group therapy information is on the back here. And feel free to take any of these cards if you want to have a stash with you. So, questions for any of us? Fire away.
I have a grad student who's being counseled, coming in there and being counseled by one of their classmates. So can they request to meet with somebody else?
Absolutely. The grad students are in a particularly tricky position because their peers work with us, and we can't do without that labor force. But they've got a couple of options. If they're willing to just come in and do the intake with whoever happens to be on intake duty, they can be very selective in what they disclose. Like the intake counselor is going to be sensitive to that and not push them to tell me more, tell me more. That would be the easiest way. And then when they get to the intake meeting and we're all discussing it, the intake counselor is very careful to use initials or to just say, hey, this is a peer, so I'm not going to say their name, and a senior staff needs to pick them up. And then in terms of ongoing counseling, always, we would never pair a graduate student with an intern, always. Some grad students don't even want to do the intake with a peer. Again, understandable. Just call Sheila, our secretary, let her know that that's the deal, and Sheila can tell them when senior staff are on intake. So they may end up waiting just a few minutes longer to get one of us, but we do intakes as well, and we can work that out. Yeah. Or if they just want to have a meeting to talk about what outside referrals, we can give them outside referrals. Some of them don't want to use the counseling center at all, and that's understandable.
I have a question on this. As far as our obligation to the students, is this pretty much covered? What would we do about sort of special circumstances kind of thing? Somebody who's got a problem, but a disability, but these accommodations just don't quite fit for this class. An example, a student just, I teach a class on sightseeing, and a student has dyslexia, mild dyslexia. None of these accommodations are going to help. I have no idea what to do because the class is all about, reading first, immediate reading. It's a real challenge.
That's where I come in, and like I said, I'm a mediator, and we kind of negotiate what are some things that are fair and right without fundamentally altering the course. We never want to alter the course so severely that we're not getting the credits that the syllabus says we're giving, But we also want to make sure that we're just and right, and that the student has a chance, even though they have a disability. So the first thing is for you to kind of think and percolate and think, what could I do? What could I alter without changing the entire meaning of this class, but that's still fair and just and right for her having a disability? And then from time to time I've had to work with the faculty members, the three of us kind of sit down and have a discussion. That comes later. It's better if you can figure it out, and if you want to, like Chrissy was saying, talk to me and brainstorm some ideas. I don't have a degree in music, but I could give you some ideas about education in general, of what has worked or things like that. Does that help? Does that make sense? Okay. So think about it first, and then let's talk about it, and then we'll see how we can accommodate for her or him.